Thank you very much for being with us. The stand is yours.
Good morning. I'm Chloe Cole, an 18-year-old detransitioner, and I was robbed in my childhood. The perpetrator was a destructive ideology that has captured some of the smartest individuals in Western culture, including doctors, therapists, and others within the medical and educational institutions. The transgender ideology consumed me as a person when I was only 12 years old. The medications have wreaked havoc on my entire body, and I am still feeling the damage years later after stopping treatment. And I will for as long as I live. I am a detransitioner and former transgender child, not quite unlike the trans children that radical transgender activists are trying to raise. At the tender age of 13, I was fast-tracked into medical transition by my doctors, who behaved more like abusers and meat butchers with puberty suppressants and cross-sex hormones, and my breasts were ripped away from me at 15 years old with a double mastectomy. I don't know the status of my fertility. I don't know whether I can safely carry a child to term or how many years have been taken off my life by these fraudulent treatments. I have no idea because my healthcare provider has failed me at every turn. I was only a child. I didn't deserve any of this, but I have to live with joint and spinal pains because of the puberty blockers. My voice will always be deeper and weaker than it should be. My body and face will always look more boyish and underdeveloped than they would have. And my urinary tract is sensitive and prone to infection, all due to the testosterone abuse. My breasts, a huge part of my identity and sexuality as an adult woman, will never be a part of my body ever again. And I have no idea what the fluid is that leaks from my areolar skin grafts. I wake up every morning, and after every shower I take, I have to tape up these wounds with bandages so that this fluid doesn't stain my clothing and bedding. No child, and frankly not even any adult, deserves to live like this. Up until now, many of you have been complicit in the destruction of thousands of children like me. Children who feel they lack a place in the world, many of whom are autistic, come from broken homes, or have been sexually traumatized. Many of you are still complicit in the abuse. Today is your chance to turn this around. The children of Ohio need you. The next generations of children need you to step up for them. The world will reward you for your courage, just as it will punish you for your apathy. Thank you.
Ms. Cole, thank you for your testimony and for being here today. First question from the committee will be from Representative White.
Thank you, Vice Chair Stewart, and thank you, Chloe, for coming in and sharing your story. I have a question, and if you don't feel comfortable sharing, it's totally fine. But what was the reason that hormones and surgeries were done? Do you remember what you were expressing as a child, or what circumstances caused those who made those decisions with you to lead to that conclusion?
I was uncomfortable with my body, and this was attributed to my gender dysphoria, even though I had experienced early puberty and I had a debilitating fear of sexual assault, and actually an instance of sexual assault that occurred during my transition, but I was too afraid to tell any adults about. And I also was a tomboy from a young age, and I never really felt like I fit in with the other girls. And I didn't want to grow up into a woman because I didn't want to go through female puberty. I didn't want to have periods or go through pregnancy or childbirth or menopause, because I thought that all that womanhood had to offer was pain. I thought that being a woman meant that I was weak, that I was stupid, and I wanted to be something better than that. Nobody had ever really told me that being a woman is a blessing, and there's so many blessings that come with all of the pain that comes with it.
Ms. Cole, I have one question. Or Representative King, was that a hand or no? Did you have a question? We'll go to Representative King first.
Thank you, Mr. Vice Chairman. Thank you so much, Chloe, for being here with us today. And I commend your bravery and your honesty in sharing a very personal story, and would encourage you to also continue sharing your story.
Thank you.
As I shared earlier, I gave my family's personal experience and how we had to meet and be evaluated with a psychologist in order for my child to receive a surgery that would enable her to hear. What we're talking about today is removing healthy tissue and body parts from young people. And so I'm curious if you or your family, if there was a requirement to meet with your medical team prior to surgery to discuss the harmful effects or permanent damage. Was sterilization discussed, bone density, or loss of sexual function? Were you informed of the possibility of the harm that would occur? Thank you.
Right. So in the consent forms and during the consultations for all the treatments, I was given a list of the potential side effects, including the fact that I may not be able to have children, or that I'm experiencing things like vaginal atrophy, and that I wouldn't be able to breastfeed my children afterward. There also was a lot of information that was withheld, but I mean, most of the complications that I'm experiencing now, I didn't even know were possible. But even with what I was informed of, I was only between the ages of 13 to 15. I had no idea what any of this meant because I was not sexually active and I was a child myself. I wasn't thinking about having children. And at the tender age I was, my brain wasn't fully developed, and I also hadn't lived very many years in the world. So I didn't really have the necessary experience or worldly knowledge to be able to make a decision on something like this.
Thank you, Mr. Chairman. Thank you. I think your testimony confirms what we all know, that a child could not fully comprehend the beauty of motherhood, the meaning of infertility, the possible loss of sexual function that comes with transitioning at such a young age. Children could never fully imagine the loss because it's something they've never experienced. Again, thank you so much for sharing your story and for being here with us today.
Thank you.
Representative Liston.
Thank you, Chairman, and just follow up, I would agree, right? We know that children don't have the capacity to make complex medical decisions. That is why they do so with their family in any disease state, right? But thank you for coming. I know you've been here before. I also know that you've shared your story quite broadly, and like you've gone around the country and some of the laws are named after you, and I think there's even a lot of videos that people share. So I'm also trying to get a sense of like how much of what you're describing is related to Ohio. Again, knowing that you have this story that you share broadly. Was any of this in Ohio in terms of the care that you received?
No, so I'm from California, but that doesn't matter. The laws of physiology and morals and ethics still apply here. And I come here as a final warning, because if you hear a story like this from your own constituents, that means you've already failed, which I actually do know somebody from Ohio who has been through these treatments and detransitioned, and they went under these treatments as a minor, but they're not here today because they do not want to come forward publicly because they've tried in the past and their life was ruined by the response from activists. And they've also been physically disabled by these treatments. They have neuropathy from a combination of the testosterone injections and from the puberty blockers.
Okay. Thank you.
Representative Stewart.
Thank you, Mr. Chairman, and again, thank you for being here. Obviously, you have publicly expressed regret over the procedures that you've been through. Kind of a two-part question. I think you can certainly kind of take it together. Is A, if you're willing to share, were your parents pressured in this situation? What are their, as a parent, I'd be kind of heartbroken to hear my child, talk about this level of regret. How do your parents feel today? And what was their kind of experience in going through this process with you? And then the second part of it is, have you spoken to any of the physicians or clinic personnel that you previously worked with and how have they kind of responded, if they have, to your regrets over the procedures?
I mean, my parents absolutely feel like they were duped into this just as much as I was. They were told that they weren't given any other option. They were told that regret was rare and that it was more likely that I was going to regret going through puberty. And if I were forced to, I would certainly commit suicide, which wasn't true. I wasn't suicidal until after I was put on these treatments. I mean, they trusted the medical professionals. They didn't know what to do at first because as much as they wanted to be accepting and accommodate me, they didn't know what to do. And they thought that by sending me to therapy, that maybe these issues would be sorted out, that they would discover the underlying issues that were making me feel this way. But that never happened. And they had to live with seeing their own child morph into a person that they weren't. And yeah, I've gone back to all my doctors who helped me transition, and I haven't gotten any help with detransitioning at all. I've gotten absolutely no guidance on how to go off of hormones from my endocrinologist. In fact, I remember I specifically requested, I told her that I no longer identify as trans. I want to be a woman again. And so when I get the results back from my blood tests, I ask that you send back the guidelines for a woman my age so that I know that where I'm at relative to the average woman. And she failed to do that. I mean, it really should have been a simple click or two, but I kept getting the results back for a boy my age. And my gender specialist told me that just going through what I have and coming out of transition with regret was just another part of my gender journey. And my surgeon, last year, I had an appointment with him to tell him that I'm having some serious complications having to do with the areolar grafts that they used as part of my surgery. And he just brushed it off as this leaking of fluid coming mysteriously years afterward was normal. And his advice was just to put Vaseline on it, which gave me a skin infection. So I haven't gotten the appropriate care that I need post-transition. And it's likely that I'm going to have to go out of my healthcare provider to do so, which will be very expensive because insurance won't cover it.
Thank you very much for being with us today and sharing your story.
Thank you.